Jimenez, nurse practitioner at Dunes Family Clinic. This is Juana Williams. She's also a nurse practitioner here at Dunes Family Clinic. Today we're going to talk to you about high blood pressure. So Juana, I'm going to just want to review with you. What are some of the symptoms of high blood pressure? How would somebody know that they have a high blood pressure?
That's interesting you ask me, because most people will not know they have high blood pressure. It's known as the silent killer. Some of you will. Someone will have more anxiety, and you'll have headaches. You'll have nosebleeds when you never had nosebleeds before.
Mm-hmm.
And a lot of you, let's say you're driving along, someone cuts you off, you go off the bat. More than likely you have high blood pressure because it comes across as a symptom of anxiety.
Mm-hmm.
So for the most part, you want to get checked. You want to at least go to the doctor once a year to get checked out.
Mm-hmm. Juana, who's at risk for having high blood pressure? Should I be worried as a woman who's almost 40 that I might have high blood pressure? Or what population of people do you think should be checked?
What's interesting you ask that, because 85 million people have high blood pressure. Did you know?
That's a lot of people.
That's a lot of people.
Mm-hmm.
So people with increased stress, high BMI or obesity,
Mm-hmm.
people who smoke are at higher risk, people with other medical conditions like heart disease are at risk, people with diabetes
Mm-hmm.
are at risk, people with high cholesterol are also at risk.
Mm-hmm.
Men have a higher risk factor than women, but more and more, especially with the American diet of
Mm-hmm.
high carbohydrates and sugar, we're all kind of meeting each other.
Yeah.
And older adults.
Juana, what do you think the best way for us to have our patients or the community at large is to check their blood pressure if they're not going to come to the doctor's office on a routine basis to do that?
You know what, guys? I'm going to let you ask that question, because we all want to say, come to your doctor, come let us know. However, the truth is that you're probably at the pharmacy more than you're at your doctor's office.
Mm-hmm.
So you know those little machines for taking your blood pressure? Stick your hand in them, okay? And take your first blood pressure there. Wait a few minutes. Make sure you're sitting at a right degree angle, okay? So just like this. Take a few deep breaths. Relax. Make sure you're not wearing a long sleeve,
Mm-hmm.
okay? Comfortable. You have to be comfortable. Put your arm in and then push the button, the
Mm-hmm.
green button, so you can take your blood pressure and just relax. Let it do its reading. Let it do its thing. And then write the number down.
Mm-hmm.
You want to write two things: the blood pressure and the heart rate. Okay, a blood pressure of 140 over 80 is the cutoff.
Mm-hmm.
Under the current guidelines, that's about where it is. Anything higher than that, you want to go to your doctor. Okay, you could call us or go to your doctor and get it taken care of. And what they will do is monitor you.
Sounds great. Let's review some things that people can do besides take medication in order to lower their blood pressure or stay at a healthy level.
One of the things that we all do as doctors to take care of blood pressure is lifestyle modifications.
Mm-hmm.
So what does that mean? One, reduce how much salt you have in your diet. You could do alternatives like use Mrs. Dash or low NA, low NA. And what that is, it's just seasoning, but without the salt.
Mm-hmm.
You also want to eat less processed meats like ham or even turkey, because in order to give it a longer shelf life, they're curing it with salt.
Mm-hmm.
So change it to
Scale back on the hot dogs, you're saying.
for sure. And the chicken wings, and the one that people don't realize is the ginger ale.
Yeah.
I know a lot of us like pop, but ginger ale has a higher
High
salt
sodium.
content
Mm-hmm.
than many other drinks.
How about let's tell everybody what are some things that can happen if you have high blood pressure that goes untreated for a long period of time? I mean, the obvious things are, let's have a stroke. Somebody's going to have a stroke. Somebody's going to have a heart attack. But what about some of the other things that happen that maybe people don't know about?
Some of the things that can happen that people don't know about are things like eye disease. People can actually go blind because not enough blood flow goes into those little vessels of the eye, because you have little vessels that have so much pressure and they're so thin that you lose blood flow to your eye. Also, kidney disease. Same things happens to the kidney. You could actually develop kidney disease and end up on dialysis if you don't control your blood pressure. Okay, so there's many other things. It could affect your heart over time. If you have an excessive amount of blood pressure, you could have heart problems. You could have vascular problems. You could have less blood flow to your feet and end up with ulcers. So it affects every organ.
So you guys, if you decide to go get your blood pressure checked at the pharmacy, that's a free option for you guys to check your blood pressure and get a gauge on where you're at. If your blood pressure is high, or if you're having symptoms, or you have a history of high blood pressure and you need to see a doctor, you can come to the clinic and be a member for $75 a month and talk and text and email and come and get checked as many times as you darn well please for that $75 per month. So you guys, after all of this conversation with Juan and I during our morning coffee, if you guys are having symptoms or you've gone to the pharmacy and you've checked and your blood pressure is high, please feel free to call us or get online and make an appointment with us. We'd be happy to discuss your risk factors and a treatment plan for you as soon as possible. So stay tuned for our next week's version of Coffee Clinic and Conversations. Thank you. Please share and click like.